is a moment that happens thousands of times a day across the American healthcare system, and almost no one ever talks about it. A doctor prescribes medication, the patient leaves the office with some version of hope, and somewhere in the background, an enrollment form gets filled out, or partially filled out, or not filled out at all. And that's where things quietly fall apart. This is the enrollment gap, and it has persisted for decades through fax machines, through digital portals, through sophisticated hub systems. The problem sounds almost embarrassingly simple. A missing signature, a blank field, a consent captured in one place but not in another. The consequences, however, are anything but. I'm Tom Malone. I'm VP of Product at zPaper, where we work every day on exactly this problem. This is the Access Forum Executive Insight Series, and my guest today is Laura Viaches. She spent more than 2 decades at Eli Lilly, leading a 500-person global patient services organization and helping architect the landmark launch of Kisunla. She is now president and principal consultant at Endeavor Pharma Solutions. Laura, thank you for joining me.
It's great to be here, Tom.
So let me ask you, how long have you been working on this incomplete enrollment or missing information problem? When did you first start to try to solve this problem?
Well, I've been in market access for more than 15 years, but over the last decade, I've really taken a specific focus with patient support programs and solving the challenges around that. Patient support programs offer great services to help patients navigate their journey of starting on a medication and staying on a medication, and offer great access to information, training, affordability programs. That can only happen if they can get enrolled in the program. So as you might imagine, ensuring that patients can enroll quickly and compliantly is a top priority in the industry.
What would you say is the current state of play in the enrollment business process for hubs and PSP programs? Where are we in the digital journey for enrollment?
It's improving from when I started 10 years ago. At that point, it was largely paper-based, faxed forms, sometimes photocopied forms with missing fields. There's definitely been a push to move it to a more digital interface, and I think that's a good thing, but it brings its own challenges as well. Also, across the industry, I would say that most pharmaceutical manufacturers realize that patient support programs are important. They're more than just a cost center. They deserve investment in terms of making sure they have the best technology, and they're going after solving these problems that result in enrollment challenges, but there's still a long way to go.
How much analog is still out there, would you say? Is it still mostly fax?
That's my sense. I mean, it's pretty standard to have some form of digital enrollment form, but if you're not integrated in the standard workflow of a physician's office, they may not use the digital solution. So I remember visiting many doctors' offices where office staff would show me a binder full of photocopied enrollment forms from manufacturers. So that's my instinct, is it's still heavily paper-based, even though there is a push to move more into the digital first space.
And when we talk about incomplete enrollment forms, what does that actually look like on a daily basis for teams that are processing them?
Well, of course, the biggest challenge is the enrollment forms you never receive at all, right? I would say across the industry, enrollment numbers are far lower than the total number of patients on a particular product. So that tells you that your incomplete enrollments actually include a subset that actually never get in front of a manufacturer's hub office. Of those that do, you're looking at a wide range of errors. It could be missing signatures, incomplete information to identify the diagnosis of the condition. Again, it just, every field that's there, it can be missing. And some of those fields are essential in terms of hubs being able to make the next step and reaching out to the patient or the payer.
What would you say are the most common types of missing information?
In general, I would say missing signatures are the most frequent. A lot of times you'll get the information from the office staff, but it'll be missing a patient signature. And that one is in particular a challenge because then you can't contact the patient. But again, information that you need to move forward include not just the signature, but understanding what services the patient is requesting, their insurance information to be able to do a benefits investigation, benefits verification. In some cases, the prescription is essential. So again, for every field there is, I've seen it missing. It's just some are just absolutely critical path errors that you can't move forward until you get that information.
And that's a huge problem. In your experience, what percentage of enrollment forms typically arrive with missing information? How big a problem is this?
So it's tough to give an exact percentage because it's going to vary by program. But what I can say is you're definitely going to have your highest error rate typically at launch, because that's when you have many new users using an enrollment form or a portal for the very first time. So what you're going to want to do is establish, what is my baseline error rate, and can I identify common questions or errors that I can help resolve either through training, through your field reimbursement managers, or by revising your form or portal. Within a specific program, again, it can be low, it can be high, it really depends. But what I can say is enrollment form errors are a major concern in nearly every hub program. And any hub program or pharmaceutical manufacturer is going to want to understand their metrics there, get to the common errors, and resolve them as quickly as possible. You'll never get it to zero, but you should be actively monitoring that metric.
What would you say is the time course of that adoption curve for a newly introduced form?
It could take a year. Obviously you're bringing that form as soon as you're able, and your field reimbursement managers are able to deploy that form. In some cases, your sales force might be providing that form at a high level, but you have to then wait till the first time a patient presents with that condition, a doctor decides to prescribe that medication to get a patient all the way to enrollment. That's then the first time that doctor's office would experience using that form. And that's when you start to get the feedback. And sometimes you get it immediately where that form comes in and a hub agent might notice that something is wrong. Sometimes a field reimbursement manager might get a call from the office saying, we have this form we want to submit and we don't know what the issue is. And so those errors can appear through different forms, and the manufacturer needs to have a plan in place to be able to address those concerns from the doctor's office when they occur.
We've talked a lot about different kinds of missing information and the extent of the problem. Why do you think all these missing information gaps still persist?
Well, there's a lot of pharmaceutical products out there, and they all have their own enrollment processes, and there's an absence of standardization in the industry. And so if you're a key office staff member in a doctor's office and you're trying to process an enrollment, you may have seen that form before. The form may have changed since the last time you did it. You may be relying on a process used for a different manufacturer's medication. And again, it's that real absence of standardization that's an issue. If you think about other parts of pharmaceutical commercialization, there's been a lot of benefits from standardization. Think about like the NCPDP formats that you see, NDC 11 codes for, to identify specific products. That doesn't yet exist in the patient support industry. It's really, you have to make sure you have appropriate consents and authorizations. But beyond that, there is quite a bit of flexibility in terms of what those forms look like. And that just results in confusion.
I'm curious too about the electronic prescription. As more and more states require electronic prescriptions, does that become essentially another form of missing information? A form comes in and it has an old-fashioned handwritten script, potentially, but not necessarily a matching electronic prescription.
Absolutely. As you move into that space, and again, I think that's the direction we should go as an industry, is electronic prescriptions. There's a lot less chance for error, et cetera. So manufacturers need to be ready for that. It adds a host of different complexities, including, if that manufacturer is not a covered entity, they don't necessarily have a defined role in processing that script. That script needs to go to the entity that'll become the dispensing pharmacy, and you need to make sure that you have a valid prescription. At the same time, if that manufacturer is looking to do a benefits investigation and benefits verification through a PBM's API, you have to have a script. And so being able to determine quickly, do you have a valid script? Where is that script located? How is that script accounted for in the prescriber's electronic medical records, if applicable? These are all new things, even since when I started working in this space 10 years ago. And again, it just begs for more standardization to reduce that complexity. Because again, going back to basics, what you're trying to do, if a patient has identified that they have a concern, the doctor has identified an appropriate medication, prescribe the medication, you're trying to make sure the patient can get that medication at an out-of-pocket that makes sense for that patient, and then address any questions they have. That is the list of goals you're trying to accomplish. When you get these new variables like electronic prescriptions, the more solutions that you can have that just make that easy and straightforward so you can get back to those core activities is essential.
So we've talked a lot about the kinds of missing information, the extent of the problem, some of the drivers of the gaps that you see in the marketplace. Can you walk us through what happens when that incomplete enrollment form arrives? What's the recovery process look like? How do you actually deal with that problem today?
So every manufacturer will have their own business rules, but in general, the first you want to identify, is this a critical field error or not? Meaning, if there's some piece of information that maybe you've already captured the consents and authorization, and you could pick up that information later, things like a missing address, for example, maybe you can move forward and contact the patient. The ones that concern me the most is when you don't have the patient signature and their authorization for you to be able to contact them by phone or by text, because there you have a situation where a patient has left their physician's office, probably has been told they'll be contacted by the manufacturer's hub support program, and they're not hearing anything. At the same time, the manufacturer has very strict rules that they have to follow, things like the Telephone Consumer Protection Act, HIPAA authorization. So this really becomes a stop, in the pathway, and you have to go back to the doctor's office, sometimes as a hub agent, calling the doctor's office saying, we received this enrollment form for the patient. The consent and authorization or patient signature is missing. Can you please, doctor's office, reach out to your patient and see if we can get that signature? And that's just frustrating. It slows the whole process down. You're asking another step in the workflow of the physician's office. And, your risk of never actually getting that enrollment form back goes up significantly at that same point. And again, the point I want to highlight here is just, again, how important it is to be integrated into the physician's workflow from the start. Because even in a case where you have appropriately captured the patient's signature on that authorization form and you reach out to that patient, if they haven't been talked to by their physician's office, that they'll be hearing from a manufacturer's program, that leads to a lot of loss to follow up as well, because patients are leery of outreaches from phone numbers and texts that they don't expect or understand what they're coming from, particularly talking about medication. So again, right back to just ideally you build a process that works for all the stakeholders, the HCP office, their staff, the patient, and the manufacturer, to go ahead and streamline that process and move forward. How you get that information? Again, first path would be a hub agent calling the doctor's office, following up on the form. If you don't hear anything, if that manufacturer has a field reimbursement manager that has a relationship with that office, they may go and say, hey, we've got some questions and need some assistance, but they're very limited on what they can do until they've received those consents and authorizations from the physician's office. So it really is a flow interruption.
That definitely sounds like some significant impact to time and cost. What have you seen in terms of those impacts on you, on the hub, in general, and the patient?
That just leads to frustration, right? I mean, if you're the prescribing physician, a lot of times you're not actually involved in filling out the form at all. But at the same time, you might get an inquiry from that patient to say, I haven't heard anything, what's going on? If you're the key office staff member that's filling out these forms, I always say, this is one patient amongst many they may be dealing with, not only for enrollment, but things like prior authorization, et cetera. So there's just a lot of paperwork involved. So there's frustration there. Of course, patient, leaves the doctor's office ready to start on the medication. The doctor has prescribed the medication that is most appropriate for that patient. They're ready to go. They have a lot of questions. And, as a manufacturer, you're building up trust with that patient and establishing a relationship with that. All of that breaks down when you don't have, the appropriate form filled out.
What is the effect of that on patients getting on therapy? Are we talking about delays of days, months, weeks? What's the typical delay to get on therapy?
It depends on what route the patient's prescription is going for dispensing. In some cases, patients that have prescriptions that go direct to a retail pharmacy or specialty pharmacy that is completely separate from the manufacturer hub, and the enrollment in the manufacturer hub is not on the critical path. In that case, the patient actually, may receive their medication, but not benefit from the additional information or training that a manufacturer's hub program offers. And particularly when I say information, there are many patients that are eligible for manufacturer copay card support that manufacturers' hubs can, after they receive the results of the benefits investigation and benefits verification, alert the patient if you have an expected out-of-pocket of this, but you are eligible for a manufacturer copay card, which can reduce your out-of-pocket costs significantly. So you could have a case even on that path where it seems streamlined to be able to get the product dispensed, where the patient receives a phone call and is told a copay that is much higher than it needs to be. And the patient may say, you know what, I'm actually going to hold on that medication right now. So, and then you have cases where going through the manufacturer's hub plays a more critical role. That could be a case where a doctor's process involves enrolling all patients into a manufacturer's hub program, or a manufacturer may have a copay card support program that requires enrollment in the hub. In that case, it really does shut down the process until those essential pieces of information or signatures are obtained. In that case, the patient doesn't gain access to the product. How long it takes, it depends how long it takes to resolve that issue. There are some physicians' offices that are able to very quickly resolve that. There's some where it takes significantly longer or never. Again, if it's a case of a missing signature, the physician's office needs to find a way to get that information from the patient. Maybe they have to come into the doctor's office, or maybe there's an e-signature tool. Nonetheless, that's a step. If the patient never answers the phone, it goes into that lost to follow-up category, unfortunately.
So we've talked a lot about the challenges the industry faces in this regard, some of the gaps and so forth. The industry has invested heavily in digitizing enrollment. Why hasn't that solved this problem?
Well, I think it comes down to the lack of standardization. So even though you're now dealing with a computer interface as opposed to a paper form, some of those same questions that caused confusion on a paper form can exist again. I also think portal fatigue is a real thing, and it's something that I've heard about quite a bit when I've been in doctors' offices, where sometimes they'll show you, here's your form, here's all these other forms online. I get confused. I have 8 different passwords. I just don't even want to deal with it. And then another challenge that comes up is when healthcare office workers reach a critical error on a digital field and don't know how to resolve it. And in some cases, they're not sure who to call. And a lot of that gets into the interpretation of what information is being requested. They go to submit, they're being told they have an error. Sometimes they wait till the field reimbursement manager comes back. That can be, a length of time. Sometimes they forget to ask at all. So again, just because something moves to a new interface doesn't mean that it's easier. They're still building into a workflow. Those same challenges that you had when there's a paper form still exist.
What would a truly digitally transformed process actually look like?
Well, if I had a wish list, one, I've mentioned standardization being important. And, again, we've seen times in the industry where we've really benefited from that, where you have many pharmaceutical manufacturers adopting a common system to make it easier for all the entities that interact with the system. So NCPDP standards would be one example. NDC 11 codes would be another example. So anything we could do in terms of standardization around enrollment, consent and authorization language, terms and conditions, wherever possible, that would help a lot. Additionally, I would say integration is another key item, and 2 things in particular with integration into the physician office workflow. So this is a standard part of, I see the patient, I prescribe the product. The next step is obvious in terms of not just filling out the enrollment form, capturing those consents, and then moving that enrollment form along the workflow. But also I'm increasingly focused on integration within EHR systems, within healthcare organizations. In many cases, being able to demonstrate meaningful use of an EHR system is a requirement. And so in many cases, this is leading to the next logical step, which is e-prescribing. And so making sure that there's natural integration between the prescription through an e-prescribing system, the enrollment form, is going to be very important to make sure those records are accurate and complete, the form is submitted timely, and patient can get the treatment that their doctor has prescribed on their behalf.
What would you say is the one thing that would most help the industry move off of analog fax at this point?
Well, it has to be easier to use, which I know is a high bar to set because, all of us have been using pencil and paper since kindergarten, right? And so it's very natural to say, here's the form, I'm going to fill in the patient's name, et cetera. So while that sets a really high bar for solution providers to hit, I do think it's achievable. We're becoming much more digital first in many aspects of our lives, but I think that would be the goal. It has to be easy to use, and it has to be seen as easier to use than an enrollment form, which again is not impossible. If you look at some of these forms, they're often 10 pages long when you think about all the consents and authorizations, et cetera. So I think this is an achievable goal.
Well, thank you very much, Laura, for joining us today. This has been the Access Forum Executive Insight Series.